both snoring and sleep apnea occur because the air intake through our mouth down into our lungs is reduced by a narrowed airway. As a consequence of the narrowing of the airway and the reduction of oxygen consequently to our brain sends a signal to us asking us to force a deeper inspiration to get more air in. As we breathe harder through the narrowed airway, the snoring sound is caused by the vibration of the soft tissues at the back of the palate, because this is the only thing that's really loose, and that makes that guttural or snoring sound, the sound.